initiative in which she is funding a number of community groups to do cleanup efforts in our community. So we're looking forward to hearing some details about that particular work. So as we do at every one of our meetings, we review the latest statistics on COVID-19 in our community, and having checked the city's Department of Health and Mental Hygiene website just a little while ago, I can report that the latest positivity rates for our community are running for the most part below the citywide rate. Citywide is at 10.6. However, in zip code 32, it's running above the citywide average at 11.21. In the zip code 33 at 8%. In zip code 40 at 9.23. Zip code 34 has the lowest positivity rate. This is for the week ending on October 31st. Zip code 34 had a positivity rate of 7.4%. So over that period, there were 187 new COVID cases in our community, for a total since the beginning of the pandemic of over 60,000. This basically means that almost 1 out of every 3 people residing in Washington Heights and Inwood has had COVID. That's really a striking statistic when you think about it. Since the beginning of the pandemic, almost 1 out of every 3 of us and our neighbors have been affected by this pandemic. 967 people have died in that period in our community since we last met. That's 12 more people have died. And since we last met in October 6th, over 1,200 more cases have occurred. The vaccination rates, I'm sorry to say, have not really improved at all. Since a month ago, they've barely budged in the 4 zip codes where people who have been vaccinated with at least 1 dose, ranging between 79 and 83%. People who are fully vaccinated, ranging between 71 and 74%. And people who have taken the trouble to get the booster shots, that's running at about half of the rate of those who have fully vaccinated in the between 34 35%. Actually pretty sad statistic. People who have been fully vaccinated, you would figure, would also have the sense to go ahead and get the booster shots. So that's really where we stand at the moment. We're still on the vaccination rates, running way behind the rest of Manhattan and certainly the rest of the city as well. So I'm told, by the way, that Dr. Karen Thornton is still stationing mobile vaccine and testing vans in the community at the Good Shepherd Church Monday through Saturday, and outside Holyrood Church on Mondays. And she's open to hearing about other places in the community where we would like to have these vans stationed as well. So if anyone has any particular ideas, please let me know. So let's move on to the rest of the agenda. Pauline Ferranti, our Manhattan Community Liaison for the Department of Health and Mental Hygiene, is with us once again. Pauline, can you give us your report?
Hi, good evening, everyone. Pauline Ferranti from the Health Department. So the biggest update is that the state's emergency declaration for MPV has expired. This does not affect people's ability to get the vaccination or treatment, but the main way this affects people is that those who are 19 years and older will now have to give consent to have their doses documented in the city immunization record. So that means not all doses will be reported into our data going forward. Also, the city is transitioning our MPV vaccination pop-up and mass vaccination sites into existing clinics. And that transition will be complete by November 14th. So starting November 14th, people can still receive their vaccinations at the DOH-MH sexual health clinics located at Fort Greene, Jamaica, Chelsea, and Morrisania. H&H also has sites as well where people can go and get their vaccinations. With regards to COVID, like you mentioned earlier, Steve, we are encouraging people to go get their bivalent booster. The season is upon us where the weather is getting colder, lots of respiratory illness going around as well. So we encourage you to get your flu shot also. But those are the biggest updates. I know I got back to you and to OC about whether or not parents in classrooms would be notified if a child in their classroom is not immunized because of medical exemption. And currently that is not a policy. So I don't know how that can be changed or advocated for. I did reach out to our team again, but I haven't heard back. But I don't know if this is something that could be brought before the Board of Health to sort of re-examine notification for parents, especially if there are multiple kids in a classroom that are medically exempt for whatever reason. But this is something that, I don't know if we've caught up with the times where most kids in school have been vaccinated and it hasn't been an issue. But as we know in recent trends, people have been claiming medical exemption for vaccination. So that might pose an issue for other children in the classroom. But again, I'm not 100% sure how this policy could be changed. So again, I looked into that and I am awaiting a response.
Thank you, Pauline. Could you just go back to point number one, the state's emergency order, and then you had some initials has expired. Tell me what that is again.
So the New York State declared monkeypox vaccination, the monkeypox situation or MPV as an emergency, like a state emergency. And under that, I think it wasn't renewed. So it was like an executive order. And it was first issued, let me see, July 28th of 2022. And then as of September, it was renewed, but then it hasn't, what does it say? It says the terms and suspensions contained will go through October 27th. So yeah, it hasn't, so because it's stated in that executive order, it hasn't been renewed, and so it's expired. Essentially, in the order, it just supports local health departments in responding to and collecting data on MPV and vaccination.
So it just means then that I'm sorry. It means that doctors who give the vaccinations don't have to report them to the city health department?
No, so the main way it affects people is that anyone 19 years and older will now need to give their consent to have the doses documented in the registry, the citywide immunization registry. So some people might opt to not have that data reported. Okay. And so that will impact, obviously, our data collection moving forward.
Okay, but that only affects the monkeypox.
Correct, yes.
So the statistics that I usually read off every month are still going to be collected.
Right. COVID. It does not. Yes, it does not impact anything with regards to COVID.
Oh, okay. Okay. I wanted to clarify that point.
Yep.
And does it affect the sites where the monkeypox vaccines are provided?
Yeah. So it's not because of the expiration of the executive or emergency declaration, but we have been planning to transition some of the mass vaccine sites into existing clinics. So starting November 14th, people can receive their vaccines at all of the DOH-MH sexual health clinics, which are located at Fort Greene, Jamaica, Chelsea, and Morrisania. And also H&H has sites. I believe they have 5 acute clinics co-located at Metropolitan, Bellevue, Lincoln, Woodhill, Jacoby, and they might have additional sites that I'm not 100% sure of. I can follow up with H&H on that. But our larger sites, like the ones in Times Square, in Long Island City, those will be phased out by November 14th.
Okay, so again, though, that specifically applies to the monkeypox
Correct.
vaccine,
Yes.
not to COVID. Is that
No,
correct?
that's
Okay.
correct.
Okay. I just wanted to. Yeah, I got a little confused. Okay.
Sorry. I'm sorry. Sorry if I wasn't clear in the beginning. That was all for monkeypox.
Okay. Oh, it's awful. Okay. Very good.
Mhm.
All right. You got to give me a little intro on that.
Yeah.
Okay.
Sorry.
Catherine, you have a question.
Yeah, I had two questions. One, is there anything to share? I've seen a lot of info floating around about RSV in children. So not sure if it's become more like, moving up in terms of like notices. And then the second thing was around like the ask from that OC had mentioned around the classroom. Do you mean for children or for teachers on medical exemptions?
For children.
Okay, because
So
I know kids
OC
aren't
was
required to be.
No, so OC was specifically asking that should there be a child in a classroom not vaccinated due to medical exemption, whether or not all the parents who have children in that classroom would be notified. And currently the policy is no. So I don't know whether or not or how that policy could be changed, but I did ask. So I think that's sort of the heart of OC's question. As of right now, should something happen in the classroom, that particular child will be exempt from attending school. So it just
No, it's okay. I just
seems
wanted to clarify because I know
Sure.
vaccinations are only mandated for staff, not for children.
Right. And actually, to further clarify OC's question, she wasn't asking that the names of the students be revealed,
Right.
only that the other parents be informed that there's somebody in that classroom that has not been vaccinated.
Right, like a general notice stating that,
Right.
there is a child in this classroom that has not been fully vaccinated due to medical exemption.
Right.
Similar to alerting a classroom if a child has a nut allergy to
Right.
prevent kids from bringing in snacks with, nut products. So I did try and clarify, and they did say that currently that is not a policy to notify parents. Even generally speaking, that there is a child in the classroom that hasn't received all their vaccinations due to medical exemption.
Yeah.
But again, I asked if that could be something that could be brought up for review, and if there was a way to revisit that policy and see if that could be changed. So once I hear back to see how that process could be, how that could move forward, I will let everyone here know, since I know it's a very important subject for folks here.
Thanks, Colleen.
Thank you. Tanya?
Yes, Pauline, is there anything you could tell us about is this COVID variant BQ, I believe it is, that's been reported on, and it's suspected to, kind of resistant to treatment? And if there's any anticipation of how that could impact our community. Sorry.
Yeah, not yet. Sorry, I didn't mean to cut you off. I don't have any specific information about that. I do know that, with the bivalent vaccination, they said that would cover a lot of the sub variants, but I don't know specifically, so I'll find out. And then going back to Catherine's original question about RSV, we don't have any specific information. Of course, we have been reading across, in the media about an increase in that among school-age children, especially. So I can try and get some information from our school group, but as of right now, we don't have any sort of written material or anything to share with the public. But again, all of the precautions remain in place. Like if your child is not feeling well, obviously, if they have symptoms, they should be tested and kept at home so that they don't spread disease in school. But I will get back to everybody if we do end up creating some materials, written materials about RSV or about any new subvariants of COVID.
Tell us a little more about what RSV stands for and what exactly it is?
So it's like a respiratory virus, much like any other virus. There isn't specific treatment for it. A child will come down with symptoms of coughing, congestion, runny nose, and it's sort of, you bring them to the doctor, they'll test them for it, and then they'll say, obviously you can give them over the counter to ease their symptoms, but since it's a virus, you just wait for it to pass through. But again, it's something where if you are in a classroom with kids and they're very close quartered and now masking is not required, it's something where it could potentially be transmitted throughout the class. So there were reports about it being more prevalent this season. Could be for a various number of reasons why, but it has raised some concerns for parents, especially since we are seeing it in children. But again, I don't have any sort of further information coming from the agency with regards to RSV.
And the current strain is affects children more than it affects adults?
I think that that's what they were saying, but I'm not 100% sure, so I don't want to give you misinformation. But I will ask our Office of School Health about it specifically and report back.
Okay. All right, very good. All right. Does that cover our questions? Jacob, did you have anything? Okay, very good. All right, well, thank you, Pauline. I guess Julio is also running late tonight and said he might be joining us around 7 o'clock. And Janelle Edwards is not with us, strangely enough. Diane, Ashley, you get a chance to go pretty early tonight. Do you have a report for us?
I do. I'm just surprised on the timing.
I think it happens maybe once every 10 years.
Yeah, well, I'll take it, as they say. As of this week, as of 11/2, Isabella had 17 residents who are positive for COVID and on transmission-based precautions, largely asymptomatic. The data really has not moved. It's 1 percentage point here or there on vaccination. Steve, I know you like them, so I'll repeat. 1% of our residents have received 1 vaccination. 91% have received 2. 24% have received 3. And 53% have received their 4th vaccination. Staff remain in compliance with DOH vaccination requirements, and all visitors continue to be screened, and COVID testing is required in advance of visiting. At the last meeting, I was asked to report on how we handle isolation, or also known as transmission-based precautions. So if a resident has experienced a significant exposure to somebody who was positive for COVID, they are put on transmission-based precautions. Typically, we encourage the resident to remain in their room, but if needed, they may leave. For instance, if they have to go to a doctor's appointment, they would wear appropriate PPE. We would, of course, notify the doctor's office that they've been exposed. Social distancing would be encouraged at all times. And if they have a roommate, both would go on precautions. Staff always don PPE at Isabella, but additional levels of precaution are taken when engaging with a resident who is on transmission-based precautions. If a resident tests positive for COVID, they are quarantined per DOH guidelines. This most often includes going to a separate unit that is designated for COVID positive residents, but can occasionally take place in the resident's room depending on the specific circumstances. As per DOH, residents remain on transmission-based precautions or isolation for approximately 10 days or until their symptoms have improved. This includes no fever for 24 hours without the use of fever-reducing medications. A resident on isolation or transmission-based precautions may or may not have a roommate. That depends on the circumstances. Food is brought to them in their room. Families can still visit wearing appropriate PPE, and supportive activities that would go on in the facility continue as appropriate depending on the resident's condition. So I hope that answers the question.
Yeah, pretty thoroughly, I would say. Let me go back to those numbers on the vaccinations. So 1% of the residents have had only one shot,
Right.
but 91% have had 2 shots.
Yes.
24% of them have had the 3 shots.
24. I'm not sure if I heard you right. 24.
Yeah,
Yes.
24, and 53% have had 4 shots.
Yes, sir.
That's fantastic.
And those numbers are holding pretty steady.
Yeah.
So we do a lot of education. We encourage it. We encourage families. So, I think we'd even like to get the numbers up from there, but yes.
Yeah. Yeah, that's wonderful. Very good. Do me a favor. Would you, after the meeting, could you send me your notes so I can incorporate them into the minutes?
Of course.
All right. Thank you. All right. Are there any questions for Diane? All right. You've escaped unscathed. Very good. All right. Janelle Edwards has appeared. Janelle, you have a report for us on behalf of the Columbia University Irving Medical Center.
Hi, good evening, everyone. How are you?
Oh,
Can you hear me all right?
I don't know that we made it clear for the record that Diane Ashley was speaking on behalf of the Isabella Geriatric Center. But Janelle, you're speaking on behalf of Columbia University Irving Medical Center.
Yes, I am.
Okay, very good.
Okay. First of all, I just would like to let the committee know that this will actually be my last meeting with the Health and Environment Committee. I'm actually no longer working with the medical center. I'm in the Office of Government and Community Affairs. November 15th will be my last day. So yes.
I hope we didn't do anything to
No.
convince you to leave your job.
No, not at all. You all have been an incredibly dedicated and really passionate group. Sorry, my child is in the background asking questions. Would it be okay if I present a little later in the meeting? I will hang around if that's okay.
Sure.
Thank you. I appreciate it. Okay.
Yeah, if it's your last meeting, we'll do anything you want. Okay.
Thank you for humoring.
I want you to remember us on good terms.
Okay.
Did I see earlier that that either Jamila or the council member is with us? Well, I don't know. I think maybe it was Jamila who was scouting the meeting on behalf of the council member. All right, so when Julio gets here, we'll call upon him. We were supposed to get an update from the New York State Nurses Association on its contract negotiations with the hospital, but they informed me later in the day that later this afternoon that they were not able to attend. So we'll move on to old business. And here's where I give my usual report on the latest statistics from the Mayor's Office of Operations on acceptably clean streets where is my report? Oh. All right, so the latest available statistics are for September, and it shows that overall we had 90.5% acceptably clean streets. We bounced back pretty nicely from the previous month in August, where two of our sectors were We're doing pretty poorly at the southern end of the district, and they have both recovered, and the southernmost sector was up at 88.2, the next one up at 87.5, and so overall we're at 90.5 acceptably clean streets. And on the sidewalks, believe it or not, and some of you may not believe it, 100% acceptably clean sidewalks for the month of September. On recycling statistics, these are for the month of August. They calculate these very systematically. So month of August, 195.1 tons of refuse were collected in our district, 16.4 tons of paper, 17.8 tons of metal, glass, and plastic. So our diversion rate, when you compare the amount of recyclables collected versus the rest of the garbage, our diversion rate was 14.9%, which is a decrease from a year ago when we were at 15.5%. The 14.9% places us at the fourth from the bottom. We're doing better than the boards 3, 10, and 11, but we're significantly below many of the other districts in Manhattan. So there's much to be done to improve our record on recycling. The DEP statistics were not sent to me. I'll have to forward them to you when they become available. Is there any other old business? Very good. Is there any new business? This could become a record breaking meeting. Jacob, thank you.
I'll bring something up, Steve, if
Thank you.
maybe fill some time. I probably should have just asked this question earlier. I don't know if Pauline's still around and can speak to this more, but was curious about the polio situation in New York City, and if we know anything more about what's going on, if we need to, as a board here, take any more precautions about that. I honestly don't know what the latest is, so kind of just wanted to throw that out there to the room and see if anyone has any more thoughts on the matter.
Well, it's a very good question, and I'm sure that Pauline is prepared to answer it.
Hi, Jacob. So there's no new information around polio at this time. So still no one in New York City has been reported to the department for having polio, which is a reportable disease to us. But again, we encourage everyone to check their immunization records, make sure they are fully vaccinated. Even adults can go back to their primary care physician to complete their dosage if they haven't done so. But again, this is something that all children should be vaccinated, and it is something that we do require in schools. So other than that, there has been no major update with regards to polio.
So there have been no cases in New York City at all?
That's correct.
So the cases that we heard about, was it a month or two ago, were those all upstate?
It was in Rockland County, I believe, and then I think there might have been a case in Long Island, but I'm not 100% sure. But I do know for sure that there have been no cases in New York City.
Right.
And Pauline, correct me if this is wrong, but I thought a big part of it was just detecting virus in wastewater. And so that was the concern, was that there might be cases in the community.
Right.
Okay.
Correct.
Well, I guess if there's no cases, that's positive.
Yes.
Oh, so it's as positive as you can get. All right, very good. Is it so that Jacob does not qualify as new business. So you were technically out of order. So
my apologies.
Retroactively, I'm ruling you out of order, and but we'll include it in the minutes anyway. And any truly good new business? No. Okay, very good. Janelle, is it possible that you would now be ready to give a report? Okay. I guess she's taking care of her kid. So I don't know what to do at this point. The council member is not due for like another 20 minutes. Uh,
Can we message her, Steve, and see if she's able to join sooner than that, or like to
yeah, let me see if I can get a hold of her.
Okay.
All right, Carmen can join us, but she's saying that she doesn't have the link. But Paola, could you send it to her again? Oh boy, Paola? Oh, brother. Viola, are you with us?
Steve, do you want me to try and forward my link?
Now, let me send the, let me go into my emails and send her the general link. I guess I could then promote her. I hope that's the case. All right, I'll be right back.
I see a hand up from Janelle, Steve.
Yeah, let me just check for Janelle. I'll call on you in a moment. Let me just check to see if Carmen has joined us.
Sounds good, Steve. I was just gonna offer to go as you waited for Carmen, but whatever you think is best.
No, I'm going to call on you in a moment.
Okay.
So- why can't I? Oh God, now I can't get in to see who else is joined. All right, well, I tell you what, Janelle, you ready to give your report?
Yes, I am.
Okay, very good. All right, go ahead.
Okay, again, everyone, apologize for the initial delay. Usually you get to me near the end of the meeting, but I'm just gonna give a really brief report about some things that we've been up to here at the medical center. So first and foremost, Ross is hosting a post-election panel to discuss the midterms implications and trends that they think we might be able to expect depending upon the makeup of Congress. This will be done via Zoom, and everyone, the public, is invited to attend to possibly learn more. So he's going to be working with a few other political persons who can give more information about that. On the, oh, I'm sorry, my daughter's crying. I'll be right back, Steve. My apologies.
Okay.
Steve, did you try to text Paula?
No, I did not try to do that. But I sent Carmen the general link that the office sends out, and am I correct that if she joins as an attendee, we can promote her?
Yes.
All right, so at this point, she hasn't joined. Oh, okay. I see. Well, this is maybe got to be one of our strangest meetings. But Julio is now saying that he'll be joining us in a few minutes.
Steve?
Yes.
Um, should I wait, or in terms of, I guess it's new business?
Well, if you want to bring something up, go ahead and bring it up.
Well, I mean, I think I sent something to you about the city council passing a whole series of maternal health bills and related. And I would like to hear more about that and how, you know, that will translate, how, the impact that can have on the community. And yeah, I'm really curious about that, considering, the importance of those bills.
Well, that's a good point. Pauline, is that something that you might be able to talk about at next month's meeting?
Sorry, I missed the first part.
Tanya's pointing out that the city council recently passed a, a, a group of bills dealing with maternal health issues. And we're wondering exactly what those bills cover and what the impact might be on in our community and elsewhere. Is that something you can check up on and give us a report on at the next meeting?
Sure. Yeah, happy to do that.
All right,
Thank
Tanya,
you.
keep those ideas coming. And actually, when the council member joins us, we could also ask her about those bills.
Absolutely.
I hope somebody can like splice this video together before it goes out on Facebook or whatever.
Nope, you're live.
Oh, we're live. That's right. We're live. Well, I apologize to anybody who's watching this. This is not our normal type of meeting. Oh, it's the return of Janelle. Is everything okay, Janelle?
Yes, the crisis has been averted. I have a first grader, so now everything is like a federal case.
All right. Well,
But all is well.
all right. Very good.
Okay, so let me start again. Thank you again for your patience. This is not characteristic of my reports or the meetings.
No, Janelle, that's okay. Nothing tonight is going according to oil. No part of this meeting is happening in the way it's supposed to go.
I just don't know what's happening.
Don't feel too bad.
Okay, I won't. So I'll start again. Coming up on Wednesday, November 9th, the Ross Farmer is hosting a panel of political experts to review the results of the midterm elections. It's open to the public. It'll be happening on Zoom, and you all are invited to attend. On Tuesday, November 22nd, we will be publicly acknowledging this year's Dyckman Scholars. So this year we have the privilege of awarding 3 Inwood and Washington Heights residents who are also now undergrads, first-year undergrads at Columbia. And we're just excited about all of the hard work that they've done and looking forward to really helping them succeed in their undergraduate education. So they'll be presented the scholarships and during the general board meeting. This coming Wednesday as well, the College of Dental Medicine is in the midst of establishing a center for airway diseases. And as part of that effort to help learn about what is the need in the community and to help spread the word, they're filming a documentary. And we're inviting participants from the public to come if you have any issues with snoring, breathing, or something else might be going on. We'd love to talk to you for about 5 to 10 minutes. I myself will be there to help out with the event. And if you know of anyone that this might be of a benefit to or who might be interested in sharing their story, we would definitely love to speak to you about that. Time slots are available. Just some events that we had on October 11th, we had the opportunity to celebrate Hispanic Heritage Month on Plaza. We gave away empanadas, ginger tea, and there were a number of cultural performances for the public to enjoy. In addition to having the performances, Coach Dave was there and a lot of other children with him as we had a read along sponsored by one of our community partners, Literacy Inc. We also had Halloween Haven this past Monday, where we celebrated the season, gave away treats such as toothbrushes and toothpaste because we're healthy, school supplies. And what else did we do? We also had arts and crafts for the children, and we gave away 200 supplies, including books and other goodies for those who were interested and who stopped by.
Janelle, you gave away, I'm sorry, toothbrushes and toothpaste
Yes.
For Halloween.
Yes. Trying to promote health.
What was the toothpaste? At least maybe candy flavored?
It was not candy, but I think it was sparkly. Like that's the yeah, like it's like Crest or Colgate sparkly fun. You know, not
okay. Not chocolate or no?
Not chocolate. Honestly, none of the children showed any disappointment. So they were very, very, I think, considerate and well-mannered. They were like,
where did you find these children? Okay, go ahead.
Yes, that was exciting. We also had books that were the courtesy of the Little Free Library and Literacy Inc. And just to talk a little bit about our ongoing program, Seniors Aim High, which happens every Tuesday at the Armory. It's been a success from what I've heard. Over 100 seniors come by the Armory every Tuesday to participate in physical activities and then to join discussions with residents and other health experts on topics that are of interest to them. And the group of people who have been coming have been really dedicating and spreading the word. If anyone here is interested, I still think there's room for you to stop by and join the program and join some of the excitement. In terms of one last announcement, the Little Free Library is having a book drive on this Friday from 4 to 6 p.m. on Haven Plaza, where they're collecting books. If you have any that you'd like to donate to the Little Free Library, please stop by to do so. Does anyone have any questions or comments?
Well, before I get to Tanya, you'll be able to send me the report.
Yes, I will. This Thursday has been, as you noted.
Okay, I mean, before you leave the job, I hope. Tanya, go ahead.
Yeah, just so you know, Carmen De La Rosa is in the attendees.
Thank you.
Yes, Janelle, I just wanted to thank you for, let me just let myself be shown here for a minute. I just wanted to thank you for your, service to, us and in the time that you've been here. Really appreciate your presence and your positivity and assistance and over this time. And so just wanted to let you know that, your presence was noted and needed. And so just want to thank you.
Thank you, Tanya. It's very kind. I really appreciate it. And I will miss you all. If you see me, walking around, please say hello. Don't be a stranger.
All right. Well, the same goes for you. And I think we unanimously endorse what Tanya said. All right. So, thank you, Janelle. Please remember to send the report. So we have now been joined by Councilmember Carmen De La Rosa. Thank you, Carmen, for joining us. And we're anxious to hear about the New York City Council's clean initiative and how it affects our community and the groups that you were able to fund through that initiative and what kind of good work that they've committed to do.
Thank you so much, Steve, to all the members of the board and the members of the public that are here for the opportunity to come before you. First, let me say that I'm so excited to talk about garbage because when I walk in the street, it is one of the main things that people come and talk to me about. And I truly do believe that a clean community is a healthy community, is a safe community. And so I'm excited about what's to come. And I want to say that some of the investments that have come to our community are part of the larger city council budget. There was a very deliberate effort during the budget negotiation to make sure that we were restoring the sanitation department's budget to pre-pandemic levels. I will say that there is unfortunately a bleak financial outlook for the out years in our city budget. So I know that there will be hard and tough choices for us to make as we negotiate budgets going forward. But I want you all to know, and I want the community to know, that I will always prioritize the cleaning services in our community. So just to give a little recap of sort of what the annual budget for that passed in July of this year had in it for sanitation services. It had $22 million for litter basket services across the city to augment the current services to twice a day, 6 days a week. There was a restoration of $18.5 million to the sanitation cuts pre-pandemic, as I already mentioned, $7.46 million for precision cleaning, $1.4 million for e-waste collection, $4.9 million for lot cleaning, $1.9 million for street cleaning, $4.8 million for rat mitigation. More on that in a bit. $1.28 million for new public waste container pilot, which has already begun, and we'll continue to work to make sure that our community is considered in for future phases of that pilot as well. And then there was sort of the discretionary funding that through, as a city council woman, I'm able to allocate to augment those services in our community. And of course, that happens with taxpayer dollars. So it's your own dollars going back into the community. And for Washington Heights, Inwood, and Marble Hill, it was a total of $365,000 additional dollars that came in, $85,000 for Parks Equity Initiative, and $280 for the New York City Cleanup Initiative. The reason I mentioned both of those is because under the Parks Equity, we're able to have some cleanups in the parks. I know there's some friends of groups that understand that the cleanliness, and I know Steve, you understand this very well, but the cleanliness leading up to our parks and then inside our parks goes hand in hand. And so we want to make sure just to mention that. So for let me also say that we have been working with the New York City EDC to bring a swarm event to our community. And what a swarm event does is that the EDC, working with the Volunteer Corp for the city, and organizations like CEO and the Doe Fund, they spent a whole week in Upper Washington Heights doing precision cleaning. This is in addition to the actual services that we get on a daily basis. I'm happy to report that I followed along on that operation, and I saw how the groups, were able to go into streets that are not often serviced. They also were able to remove graffiti and help with illegal dumping sites across the district. Our hope is to continue those programs throughout the district. But in addition to that, through the New York City Clean Initiative, we were able to allocate some funds to some local groups to make sure that there is, again, supplemental services. So in addition to the Department of Sanitation Services, and those groups are Community League of the Heights. For community cleanup events, they received $28,000. We also gave $10,000 to the Inwood Merchants Association, which is a newer organization. Because they're a new organization, they have a $25,000 cap for the first year. So we were able to allocate $10,000 of that for cleanup services along the Inwood commercial corridor. Friends of Wheels, we allocated $28,000 for community cleanup events. They have this organization, Future Ignites, and they do a lot of work with our youth, teaching them about environmental justice. And cleaning and having clean streets is part of that. So we're working with them to create some community cleanup events as well. The Washington Heights bid received an additional $28,000 for sanitation cleanups along 181st commercial corridors. The Center for Employment Opportunities, CEO, is actually, I'm really proud of this program. It's a district-wide cleanup. They employ community members as sanitation assistants. And what it does is that it's a reentry program. So our neighbors who are being released from incarceration have the opportunity to work with CEO and have actually decent paying jobs in the community through this initiative. And we allocated $47,000 to them. There is a group called Bameso USA. They have a youth volleyball team. As part of their programming, they teach civic engagement. And that group received $28,000 for cleanup services as well. And then we were able to allocate an additional $83,000 to the Department of Sanitation that will go to the purchase of new baskets. There have been disappearing baskets in the district, and we're happy to announce that we've been working with DSNY to replace some of those baskets, as well as do cleanups, additional cleanups and litter pickups during the week with that money. So there's a lot going on in terms of what we are proposing, what we're doing. As I said, by design, we made sure to prioritize sanitation funding for the district because we saw it as an area of deep neglect. And I just want to say two more things that are not related to the cleanup money. First, rat mitigation has been a huge priority, not only for our office, but for the city council. Last week, we passed a suite of legislation through the city council to try and make it easier to deal with the booming rat population in our communities. And I was proud to be a co-sponsor of those bills and work with Councilmember Abreu, who was one of the lead sponsors in that bill. And then lastly, but I think relevant to this conversation, is the outdoor dining sheds. Well, I call them the sheds. I know people don't like that word, but the outdoor dining structures, there is a conversation afloat right now in the city council about the future of those structures and what those structures will look like going forward. I firmly believe that we must do away with those structures as they exist right now. I think that they are adding to the waste that we see in our communities. And I'm looking forward to engaging with the community and the city council colleagues on what the future of that program looks like. I definitely support a version of that program that is movable furniture, but definitely I'm engaging with the community on and looking forward to your feedback on what that should look like going forward. So with that, I'll turn it back to you, Steve, and happy to answer questions.
Okay, well, would appreciate it. I wasn't able to copy all of those numbers and all
No
the
worries.
you read off. So if you could forward that to me, I would appreciate it so I could incorporate all that information into the minutes. Certainly the 83,000 for sanitation, if that results in additional litter basket collections on our major
It will.
Broadway, especially maybe, and St. Nicholas, that would really be helpful to the community because many of those litter baskets are often overflowing. As you probably know, we have an issue in the community, and I'm sure elsewhere, where people find it easier to dispose of their household garbage by taking it out into the street, maybe, instead of bringing it down to the basement of their buildings. And so very often a lot of our baskets quickly fill up and are overflowing. And so we really, apart from the normal routine of people throwing litter into those baskets, we need frequent collections in our district. Anything you can do to support and that you could these additional pickups is certainly welcome.
Yes, they're gonna go towards 2 additional. Right now, we're in the process of talking to sanitation about this, but the idea is that we'd have 2 days of the week where there'd be an additional pickup. Like the pickups, I think, are divided in 4-hour blocks, so they'd be each on 2 of those days of the week. There'd be an additional 4 block of services in the community year round. So it's a huge increase in what we currently have, and it would be district wide. So I'm happy about that.
All right. So once you have that worked out, please let us know so that we can help spread the word.
Thank you.
All right. OC, you have a question?
Yeah, I have a question. It's more like a comment plus a question, Carmen. It's in regards to rat mitigations. I think one of the things that the city needs to start taking a look at is the population of mousers called cats that can help out in that and can mitigate some of the problem. And I understand that there is an issue with Department of Health, with bodega that can't have cats or whatever, but we really have to start, all the bodegas that I know of that I helped to get their cat fixed have cats, some of them more than one, and they're doing a great job. Okay. But I think that the city needs to look at that as a positive. If a bodega or a store has a cat, help them get the cat fixed, which we can talk offline about that, and deal with the Department of Health in a way that, okay, as long as your cat is fixed and vaccinated, it shouldn't really be an issue. And it's not. So there are solutions, but and that will help on other, in another way. It will help like highlight getting your cat fixed and also in a good health, and it will help the population of cats that's just growing in the city, because a lot of people are not fixing their cats. A lot of people are dumping their cats unfixed And who is dealing with that if not us, the rescuers? As you, I don't know if you know, I'm doing catch rescue in Inwood for 9 years. This year is horrendous. The number of dumpees, it's incredible. And I don't do adoption, so it's more burden to me. So what I'm saying is this: we should talk more about it offline, but really this is something that has to come from city government. That said, all right, we will help these store owners and the supermarket owners that I have cats, get them fixed. Get the Toby project here, they can come, or the ASPCA van that they are not yet back in operation. The mobile van is not back in operation, and it's a major problem. And really look at that. This is a holistic way to look at rat mitigation, and by that, solving some cat population. But apparently nobody looked at that at New York City, and it's absolutely unfortunate. And what we go through is just insane. And there are not enough appointments to get it. So I'm going, we should really talk offline about the problems that our community face, because we are low income community, and I'm dealing with some residents that can't afford $10 to get their cat microchip. Okay.
I'm happy to
that
talk
problem,
offline.
and it has to be resolved. It really has to be resolved. But in terms of rat mitigation, that program needs to be part of rat mitigation. Cleaning, sanitation is all great. This is wonderful. I agree with you. Those sidewalk cafe sheds or whatever you call them, they are not in great situation, and then some of them have to be demolished because they're not just attract rats. But with that, it's an opportunity to solve two problems. So I urge you to please bring the spay neuter clinic here, and something need to be done on the city council level. And I hope to talk to you offline
I'll send you
about
an
that.
email. Yes, I'll send you an email, and we'll set up a phone call. Thank
Thank
you so
you.
much for your expertise on that. Yes.
All right, thank you. Tanya?
Yes. I, first of all, I wanted to say, yeah, I definitely agree about the sheds and something needing to be done to address that. I was curious of whether, your office, or you can ask DOT to provide us some information about those in our community in terms of the number of abandoned sheds we may have. I'm just really curious about, what that looks like in our community. I mean, I have some idea, but not obviously a complete picture of what, how many of these abandoned sheds do we have, the impact on our community in terms of that, any ones that have been removed or slated to be removed, like some more information about that would be really helpful for us, particularly looking at, how it's impacting the environment itself. So I was just curious about whether your office may have some idea now, or is that something that we can get an update on in this committee at some point soon? That's my first question. And the second one is, I mentioned this earlier, the city council, you all had passed a series of bills related to maternal health, women's health, and I would love to find out more about that and what impact those bills can have on our community. What is the relevance to our community, the impact that could have on our community here. I'm always particularly interested in this particular area. And it's always been a major concern for me, especially considering how many Black women die unnecessarily in childbirth. And it's really sad. There was a documentary, and I hope you've seen it or others have seen it, called Aftershock. I think it's screening now on Hulu. Believe you can still see it. But it was really heartbreaking, really looking at this issue. And so it's definitely been a concern, in terms of, that. And I was really happy to see that the city council had passed these series of bills, but I just want to know how that's going to translate to any particular specific things in our community?
Thank you so much, Tanya. Both great questions. On the sheds, I'll just tell you that I walked with the sanitation commissioner before the town hall we had, and there were a few that were obviously illegal. And we right away put in the official complaints to get those torn down. And there were some that looked abandoned. They were basically heaps of wood, for lack of a better word. And we also got those removed that same day. So we're making a little bit of progress on that. I don't have the official numbers. I will have to work probably with sanitation DOT to try and get official numbers on that, but I'm happy to report back to the committee on that. And I think that is a necessary data point for sure. On the maternal health, thank you so much for asking that question. It's something that I'm very proud of, that this council, first woman majority council, first Black speaker that we've had in the city council history, led the charge on this really, really deadly pandemic that Black and brown women are facing in our city. As a mother, I had my own share of complications during my pregnancy, and I remember how scary that was. And I'm committed to this issue. So what I will do is that I will create a special newsletter on the maternal mortality bills, and I will submit them to Steve to share with the committee. And I'm happy to talk offline some more on that, Tanya.
Great, thank you so much.
You're welcome.
I'm sorry, Carmen, could you explain a little bit about what constitutes an illegal shed?
I'll tell you, it was very interesting. So there was a freestanding shed on our walkthrough that was not attached to any business. It was leaned up against a fence of a private property and had actually, what do you call that? It's very dangerous, a propane tank attached to it. And so it was absolutely illegal. It was not associated with any business. It was on a side street that does not have a business. Yes. And so we reported that right away on that walkthrough. And there was another one down the street from that one that was in the same condition. It seems like someone just made up a fake restaurant, kind of like on the street. It was like a shed, but it was on the street. And so we reported that and it got taken down.
Oh, geez. You know, somehow that's not that surprising.
Creativity, but you know, it's dangerous, especially when you're
types of
dealing.
Created in our community. So I haven't seen that. So a couple of you came upon a couple of sheds that were not associated with any restaurant or any business whatsoever. Some people just took the opportunity to just build themselves a shed, and who knows what they were doing with them. Okay.
Yes.
All right. Very good. Good. So that was a good walkthrough.
Yes.
Jay, you have a question?
Yes. Hi, Carmen.
Hi,
I was
Jay.
just wondering, and I know this affects the health department, but it affects other departments. And since you're here, what role, if any, does the city council have in the huge high vacancy rate amongst already budgeted jobs throughout the city? And I know that isn't directly the responsibility of the council, but I was wondering what, if any, role the council had in dealing with that question, particularly in light of the fact, as you pointed out, there are going to be cuts.
It's a great question, Jay. So I am the chair of the Civil Service and Labor Committee, and actually Gail Brewer and I held a joint investigations hearing on the states of municipal agencies in our city. In preparing for that hearing, we found out that there are over 20 agencies in the city that have more than a 5% vacancy rate. It is alarming. It is problematic. One, because those jobs are sitting there empty and there's a lot of unemployment in our communities. but two, because as you could imagine, health inspectors, for example, we need more of them. Building inspectors, we need more of them. There are, besides the uniform services, there is a crisis of vacancies in our city. And so we are working through our committees to, one, have oversight over these vacancies, but two, I've been working around with DCAS around the civil service exam, making that more accessible. There's a lot of inequity. We've had 3 hearings on this issue. I'm happy to send you some materials that won't take up the time here, but it's something that we're laser focused on. And again, the mayor has now announced a possible 3% cut to all agencies as a mid-year PEG program to eliminate the gap in the budget. And so that can only mean that those vacancy rates remain vacant, those lines remain vacant, or deeper cuts to agencies that are already hollow. So it's something that I've been laser focused on, and I'm happy to send you some other stuff offline, but it is concerning for sure.
So Carmen, what you just said is that you found that over 20 city agencies have vacancy rates above 5%.
Yes, correct.
Okay. All right. Well, chances are those vacant lines will be eliminated as part of the PEG budget cuts. So actually, there may be an upside to those vacancies because when they get eliminated, people won't actually be losing jobs.
Yes, except for like if we need more inspectors and more
yes.
enforcement, then
Right.
we won't have the workforce to do
Right.
that. Yeah.
Exactly. Yeah, it would be interesting to know exactly where the vacancies are. So that's
I have it. I'll send it to you.
oh, wonderful. Very good. Well,
Yeah.
thank you.
Okay. All
All
right.
right. Well, that'll be interesting reading. Are there any other questions for the council member?
There's a hand up from the community. Cheryl Miller has her hand up, just so you know.
Okay.
Sure
Well,
decision.
can you tell which hand it is?
It's Cheryl Miller and the only in attendees.
Right. All right. Oh, here she. Okay. All right, Cheryl. Can you? I just promoted you. You can speak.
Thank you, Steve. Hi. So, Carmen, in regards to the dining sheds, so my concern is that, some of these sheds are really like the size of a small house. I understand, with the pandemic and everything, businesses were not thriving. But I think some people just really had taken advantage of it, because where I live, first of all, there's construction going on in front of my building. So I'm on a corner, off of Broadway. So when people have to turn, this thing is like jutting out in the middle of taking up room. And my thought is always, if God forbid that there was a fire in my building or somewhere on that block, and the fire engines had to come down there. As it is, like I said, I'm on the corner. There's construction going on outside my building. And they have part of the building is kind of, I don't know how to describe it, but it's blocked off. I guess the management, the landlord, because these guys are working in the front of the building. And to me, that's a dangerous situation. And not only does this restaurant have a huge dining shed, which takes up almost half the block, but they also have, I don't know how they did this, but they have tables and chairs outside with it's kind of fenced off. And there's very little room if people in wheelchairs or people with walkers have to get through. It's very, very limited as far as walking space. So I hope that the city council is going to be looking into that as well and making some changes with that, because I think a couple of years ago, there was a fire up in Inwood and there was an emergency vehicle trying to get through. And because of the dining sheds and all of that, they had kind of a hard time getting down the street. So this is also, a safety issue, as well as, rats and waste and all of that. It is a safety issue.
Yes. Thank you so much. The bill is not finalized yet, but definitely those things, those concerns you mentioned are things that the bill is seeking to address. One, making it a uniform standard. So what I'm hearing from the conversation is that they're talking about movable furniture, tables, chairs, umbrellas, things like that, not like actual physical boxes in the street. And that all it will be uniform. So like one business can have, one thing and another business another thing. If the businesses are in the program, it will be a uniform. But those conversations are happening right now, and so I welcome this feedback. I'm happy to learn more about how you think this could work. Again, remember that this program was created in out of the emergency of the pandemic, and now that we continue to reopen and recover, we want to make sure that it's still it fits the needs of the community. So your comments are welcome.
So,
All right, thank you.
Carmen, are you saying that under the new model that there will be no structures at all, only the movable furniture? There'll be.
It's not finalized yet, so I'm kind of giving you all a sneak peek. But this is the conversation that's happening, right? I have to see the final bill to see what actually is the final proposal. But the conversation that's happening is for it not to be an actual structure.
Because, but then would they still be out in the street, in the taking up the parking lanes?
That's also something that's being discussed, because it also depends on whose jurisdiction it falls under. DOT, Department of Consumer Affairs and Worker Protection. So all of those things are relevant to this conversation, and the council is considering. But there's a bill that will be introduced soon with a framework of what the program will look like.
I can't see just putting furniture out in the street without some kind of protective barriers.
Yeah, I'm assuming they will have to put something out. Yeah, some sort of protective barrier, but maybe not a box kind of covering. So we'll see. We'll see as the program moves along what the designs are.
All right. Tanya, you have another question or comment?
Yeah, one of the things that as you mentioned this, and thanks for some additional information. One of the things that always concerns me at these type of things, programs like the community, like even the community board, like just, we're the last to find out, right? Like one of the things that's bothering me is that where is the input from the community about what this could or should or needs to look like, and what are some of the concerns? I think all of those things should be front and center in terms of the model of any type of program. It should be front and center, and it's an afterthought, and that's the problem. Is the way things got the way they got is because community people were screaming like, this is not working, or this is what's happening, this is how this is impacting my block or whatever, and there wasn't any consideration about those particular concerns. And so when that's great that they're going to have there's going to be some type of bill coming forth, but when the community boards and when community people are the last to know, and then they're seeing this for the first time and they had no input, that's not a good start. And so that's a concern. It's like, when will that stop? How do we turn that around where the community is the first to know? It can be a part of the building of a creation of these type of programs that are going to be in their communities, and not the last, oh, we're going to create something, they're going to show it to you, and now tell us what you think. Like, that's not community engagement.
Yes, I hear you 100%. I think that that's the beauty of this conversation, right? I'm taking your comments down, bringing them back. But I think also that in the conversation we've already had preliminarily, there is a conversation about community input. And in that framework, what does that look like, right? So for sure, if there will be a regulation process, right? And oftentimes, like I recall back when I was a staffer, there was a process for sidewalk cafes, and community boards had some input, the council had some input. You call them up, you can, as part of our land use toolbox. So, there are frameworks that exist out there that have models for what community engagement could look like. I think it's a matter of making them better. And I agree with you that community input has to be at the forefront, not an afterthought.
All right, Jay, is that a new hand or an old one?
Old.
Old, okay. Well, you seem to be pretty assertive about that, Jay. All right. Thank you, Carmen.
Thank you so much.
Appreciate you spending time with us and filling us in. And you're going to send me the notes about the cleanup
Yes.
initiative, so I can include all those details in our minutes, and you'll keep us posted as the litter basket collection gets firmed up. And certainly keep us posted on the maternal health activities and all the other stuff you're doing in the health field. Appreciate your work.
Thank you so much. Have a good evening.
All right, take care, and keep looking for those illegal dining sheds. You did. I mean, if you could, I'm sure you can spot a few more as you're walking around.
For sure. Thank you. Thank you all. Have a good evening.
All right.
Bye.
All right. Take care. Julio.
Hi, Steve. Hello, committee members. My apologies for having the camera off. I'm just in a space using my cell phone and don't want to be distracting, having the phone move around.
Well, it looks like you're going to be our. It looks like you're going to be our cleanup hitter tonight.
Oh,
so,
all right. So let me. So I know that. Let me give you the numbers for the Columbia Island campus. There is an uptick as expected because as the weather changed, season changed. So we have currently, and this is hospital wide, we have 331 inpatients for COVID. Of that, 117 of those are at our Milstein, Choney, and Allen Hospital. So we have 117 patients. Again, I'd like to reemphasize that not all 117 patients came in with the disease. They were tested and they came in for some other condition and found that they had the disease. We want to continue to stress this is an uptick. The numbers are not going down as we hope, but again, because the season one expected the numbers to increase. We again want to stress getting the booster, getting boosted, getting a vaccine. We're still doing that at the Morgan Stanley Children's Hospital. I get many calls on a regular basis from people who want to get an appointment. If you know anyone that may approach the board, any committee member, feel free to send me that and we'll make sure to get them scheduled and have their booster administered. That is not something that will be an issue for us to do. So please, bear that in mind and please, pass the word. As the season change, we're also looking at the issue with the flu, and we are continuing to do the flu shots. We just did, and I want to thank Hebrew Tabernacle, who is an extraordinary community partner, not only with us in doing the flu shot event where we had on November 1st, along with the elected officials. Al Taylor, Assemblyman, really led that effort, along with Congressman Espaillat and Senator Robert Jackson. We vaccinated a little bit under 100 people on that day. And Hebrew Tabernacle, again, it's as a partner, they have done not only the flu shot, but they have also worked with the New York Blood Center and have held quite a number of blood drives at Hebrew Tabernacle. So I just want to give them a shout out and make sure this committee and the community knows the work that they're doing on behalf of our community members. Before I know that, Steve also sent me some questions regarding an incident that occurred, but before I go there, let me just highlight a couple of other things that are taking place. One of the things is that we're very proud of is that this morning, the Women's Chamber of Commerce recognized the hospital, New York Presbyterian, with a small champion Small Business Champion Award for our collaboration with them. And this really stems again for during the pandemic and the aftermath, where we contributed thousands and thousands of gowns and protective gears, which they in turn donated to barbershops, salons, restaurants, so that their workers will be protected. So we are very proud that we were recognized by the Women's Chamber of Commerce for this collaboration. And we will continue to obviously work with them in the future. Now, there was an incident on 165th Street, which I'm sure most of you may have learned from the news or for other community members, where a young woman, 19 years old, was caught in what I believe, what the police has indicated, is crossfire. She was hit in the, I believe, the buttocks or the top of her leg, and she was rushed. She was pregnant, not sure how many months, don't recall. And she was rushed to Harlem Hospital, where she received treatment. Now, you, like me, were wondering, well, if this happened 165th Street, why was she taken to Harlem Hospital? And obviously, that is of concerning when you look at it. So those decisions to really transport a patient when something happens is not a decision of the hospital to be able to say, well, bring them here. That is really the purview of the FDNY, the ambulance, EMS service. They determine where to take those patients. Now, I imagine that this particular patient who was pregnant, was shot, required some sort of extra care or extra services. And that can only be done really by a level 1 trauma center. Now, you may say, why aren't we a number 1 trauma center at New York Presbyterian? Well, the state really oversees those designations. Not the city, but the state designates that. They establish these criteria based on numerous of factors, including geographically and the volume of trauma centers that are in the immediate area. And Harlem Hospital is the level 1 trauma center that has been designated by the state to cover the Northern Manhattan area. And the reason they do this is because, trauma centers required specialized staff, and with specialized staff, they're limited. So this is one of those reasons why, the state sort of looks at this in a strategic way to ensure that geographically areas are covered. So, as you and I sort of look at this and think about it, I was also, somewhat taken back that this patient was not taken across the street to New York Presbyterian. But again, that's an EMS decision. It was probably based on the fact that she may have needed specialized care as a trauma 1 center, and the closest location for that would be Harlem Hospital.
So the hospital itself does not apply to become a level 1 trauma center. The state decides on its own.
Well, the thing is that the state designates the sort of geographical area. Northern Manhattan, is covered by Harlem Hospital. And so we have not really pursued that designation. Now the pediatric emergency room is a level 1 trauma center and covers the same area that Harlem Hospital will cover.
For pediatrics.
Correct, yeah. So we have pediatrics, Harlem Hospital has the adults.
This is not something that's initiated by the hospital. The hospital doesn't apply to become a level 1 trauma center.
I could take that back, but my understanding is that it is. I assume that any hospital can, in fact, make an application and make the request. Now, it will be up to the state to determine whether that's an application that's applicable, warranted based on what trauma centers already exist, and also the level of training and the level of which is highly require highly specialized staffing, whether that hospital meets those criteria, and it's a very lengthy process.
I don't know. I would assume that Presbyterian has that level of training, and whatever specializations are required. I believe I saw. I think I spoke to the president of Harlem Hospital about this some months ago, and he didn't seem to think there would be a problem with also having Presbyterian designated as a level one. But we really need to do further research on this, and I wish you would go back and look into it further. It
Sure.
it hasn't made any sense to us for years that the hospital doesn't take care of these types of patients, and it's for the things that happen all over the community, all sorts of things. People have to be rushed all the way down to Harlem, and it seems like minutes could be saved, and in situations like that, minutes are important. So I don't Tanya, you have a question?
Yeah, Steve, I totally agree. I mean, I live across the street, and that would be crazy if I was in a trauma situation and I'm literally across the street. This makes no sense. So I definitely agree that love to get more answers about that and why that's the case and what can be done to change that. I think our community needs that and deserves that, to have that security. But notwithstanding that, I had a question. I wanted to say about the vaccinations. I tried to get an appointment, at the location there, and I couldn't. So I ended up going to CVS to get my booster and my second booster, because double boosted now, and the flu shot together. I would have loved to have just gone across the street again to get this done, but I wasn't able to get an appointment. So I do appreciate if you are trying to help people who want to get vaccinated there. But I just want to know if there was something more that needs to be done, because not everybody is going to take that initiative to say, okay, let me call a community board, let me call this person and try to get in. We want to make it as easy as possible to them to get in, to get an appointment. And so is there a way to maybe do something else other than that? Could you, and is there a contact email, because someone had a question about how can they email you or reach you to get if they want to get vaccinated? Is there some way you can supply that?
Sure. And maybe Tanya, I'm not sure if you want to share that now, or you could do this offline, but I'd be very interested in learning the difficulties you had in not being able to get your vaccine at the Morgan Stanley Children's Hospital. Because we do have
appointment slots. There are no appointment slots. You go online, because that's where I want to go.
All right.
I wanted to go there.
Yeah. So I'll share my email. I'll share my email. Please, by all means, feel free to share that with anyone that's seeking an appointment. So my email is jab9029@nyp.org. So it's jab9029@nyp.org. So what I would do, Tanya, and we did this, I guess, some months ago, if I recall. I did provide Steve with a barcode that if you have a cell phone, a smartphone, you could just click on the barcode, and it throws you right into scheduling the appointment. I think Steve did manage the board to send that out once, but obviously once is not enough.
No, it's not enough.
So what we'll do is, we'll try to arrange that this barcode will be shared with the community on a more regular basis, so that when they want to get access, they're able to do that. And schedule it right there. They know when they need to go, and not hopefully not have any issues. But again, I stand ready, to be able to support our community members in their vaccination efforts.
But I think this. I'm sorry. I've said this a number of times, and I'll say it again. I really think the hospital has got to be much more proactive in getting the word out and showing that it's open to providing these vaccinations. I think there should be a huge sign out on the street in front of Choney. They're telling people they can come in and get vaccinated. There should be a way to just walk in and get an appointment. The hospital has got to do a lot more.
Steve, I agree with you, but I think that when we look at something that is this huge, it has to be a concerted effort, not only on behalf of the hospital, but it has to be a community. It has to be a concerted effort among all of us. Now, Tanya just mentioned that, she got a vaccination at a pharmacy. There's a lot of people who don't live close to a hospital, but live near a pharmacy. So we need to make that concerted effort to give our members of our community options of where they can go and get vaccinated. I agree. We need to do more to highlight the need to ask people to please not only get vaccinated for COVID, but also get your flu shot.
Yes, yes.
Which we don't want to run on the emergency room for people with respiratory issues because they got the flu.
Right.
But I agree with you. We need to have a very concerted effort to get the word out so that everybody in this community knows that they can get it.
But as good as the event was at Hebrew Tabernacle, that should be repeated all over the community. There should be it should be done in the churches and other places wherever we can.
Yeah. So where are the ambulatory care team who's leading the flu shot effort? They're also going to be hosting one I believe it's next week, and I could share that with you, with El Nido, which is on 174th Street and Broadway. So if for some reason the 15th, November 15th is a date that sticks in mind, so I'm not near where I can look at it right now, but I would certainly share those flyers with you. And where they're getting, they have hundreds of participants as well that go to the center, and we're also using them to get the word out as well.
We just lost Steve. Steve? Oh boy. Hold on, Julio, because he's probably just had technical problems.
Oh, okay.
I know. We'll find him. I just don't know. He probably had it. I'm sure his technical thing just dropped out.
Sure. I'm sure Janelle already covered that. I just want to make sure that she went over on the fact that this year we're going to have a Medical Center Neighbor Fund award ceremony, and it will be live in person, which is much needed to actually get to see people.
Hi, Julio. I actually did not mention that, but thank you for making note of that, and I'll also include.
So Janelle, you wanna? I know don't want to go back, but since I think this may be your last hurrah.
Yeah.
Before you move forward, do you want to, let the board know about the event?
Sure, not a problem. So on Tuesday, November 15th, beginning at 5 p.m. at the School of Nursing, we're hosting the award ceremony for this year's Medical Center Neighborhood Fund applicants, those who've been awarded a grant, which this year we expanded up to $5,000 to support their community programming. So 2020, we did not have a chance to celebrate. In 2021, our celebration was completely virtual. So we're excited to be in person. We're excited to see some familiar faces and to just celebrate and acknowledge the important work that a lot of the community-based organizations in the neighborhood have accomplished over the past year. So I believe that I sent an invitation to Steve as well, but I'll include in the report and you all are invited to come.
And I gotta, we gotta say that big kudos to the faculty at Columbia and the hospital. This year has been an incredible year for giving. Never in the history of the Medical Center Neighborhood Fund has, we collected as much money as we have this year and award our community members. Before, Janine said, the maximum groups could receive was 3,000. Because of that effort, the maximum they could receive is 5,000. So it's a big increase from what we've done in the past, and will be a great event to have everybody there in person. This is an event that Medical Center Neighborhood Fund Award ceremony will be held after hopefully people leave work. So it'll be starting at 5 o'clock, and hopefully that will be enough time for folks to be able to get uptown and join us. So Steve, we just mentioned the date of the Medical Center Neighborhood Fund for your records. It will be in person at the School of Nursing on November 15th at 5 p.m. Yeah, you're muted, Steve.
Right, and that's the same day you'll be doing flu shots at 174th and Broadway?
Yeah, but the flu shots will be from 10 to 1.
All right, and do you have a flyer on those flu shots?
As soon as I have a handy, I'll share with you and the board.
Right. Is that that's the Broadway Temple Methodist Church, right?
Correct. That's where Anido is located now. Yeah.
Oh, okay. All right. So yeah, we'd be happy to circulate that. I'm sorry. This meeting has had everything. I lost my a little while ago. So OC, have you had?
Yeah, I have questions. I think that that the hospital should establish that all flyers that are going out from the hospital, all information should go in Spanish as well. And so I know, Julio, we spoke about it like, I think 2 months ago, something about who's going to translation and who knows. I mean, I understand the community board can, spread the word, but it will be best that all the flyers that are getting out, especially if you want to attract members of our community, should go in Spanish as well.
Yeah, no, I wholeheartedly agree with you, OC. We try to have, at least from any flyers that we see, we request that it be done in both English and Spanish. The only one that we were unable to do was really that barcode. The one that we had originally set in is because I believe the problem was when you hit the barcode, it throws you into a page which is all in English. So that particular notice we weren't able to translate. But I agree with you. Anything that the hospital sends out to the community needs to be, that could be read not only by English speakers, but by Spanish speakers as well.
Right. If the goal is to attract community members, that's what needs to happen.
Yeah. Well, yeah. There's not only in order to attract, but it's important to provide them with the information.
Right. I'm talking about like vaccinations and any other events or health information that the community can benefit from.
Yeah.
My other question to you is the 2 individuals that got killed on Sherman and I want to say the 207, 204 that got hit by a car. There was 1 o'clock in the morning or 4 o'clock, and it was sometime in September, I think, August, September. So one of them went to St. Barnabas, the other one went to Allen Hospital. Can we invite somebody to speak to us about how decisions like that were made? Both got killed, okay? So clearly it was a major trauma. Why was one sent to St. Barnabas? The other one went to Allen Hospital. They have zero trauma beds, right? Why did it go there? So I'm not asking you, Julio, as give me an answer now. I'm putting this question, Steve, for all of us to get somebody that can answer those questions. This is not the first time that happened.
Yeah.
Patients are going to St. Barnabas because they do have trauma center and good for the Bronx. They need it. But we really have to get to the bottom of how decisions like that made. And in addition to that, Steve, we really have to try to, recruit, I don't know what, if it's not Columbia Presbyterian, then another hospital to open a trauma center here. I mean, those minutes that you spoke about before and other that it takes, it could be 30 seconds between death and life and death. So we keep we were talking about it, but I don't think we are pushing enough to get answers and to get the ball rolling in terms of what is the next step to get that happen. We need it. It's not like, we want to have it and
yeah. So also, I'm not familiar with that particular incident. Steve, if you know of it, can you share with me, and I could, find out why one was said somewhere and the other. Again, these are decisions that are made on the spot there by FDNY and EMS. So, I mean, the best thing I think for the committee is perhaps to invite EMS to one of your next meetings and have a discussions about them in terms of how these decision is to transport one patient to one hospital as opposed to the other.
But this is only one part. Yes, you're right, Julio. This is one part. One part is to talk about it and really understand how decisions are like that getting made. The other part is trauma center.
Right, that is, right.
No, trauma center in our community.
All right, but again, one has to find out, because listen, I mean, if you had this incident where two persons suffered sort of the same consequences, yet they were taken to different hospitals. One was taken to the Allen, one to St. Barnabas. I think EMS can articulate why that decision was made. Now, is it the one required trauma care and the other one didn't? I don't know. But that is something that I think, EMS will be able to answer.
Okay, so do you know anyone at the EMS system that can answer those questions? Because those, in this particular incident, and it's not the only one, those two individuals died.
Mm-hmm.
So we really need to get to the bottom of that, Steve. I mean, I'm sorry, I'm bringing it up.
Steve, I think Andrew, Steve, don't you, I thought you had dealt someone with the EMS station 171st Street.
Yeah, we've had the captain there come to one of our meetings. We can reach out to her again and ask her these particular questions.
Right.
But it may very well have been that maybe the patient taken to the Allen was in worse shape than the one who was transported to St. Barnabas. If St. Barnabas is a level 1 trauma center, maybe they still had some hope of trying to save that particular victim.
My point is this: if why was one of them sent to a hospital with no trauma bed or trauma center?
I'm speculating that it could be that that particular victim was so far gone that they may not, that a level 1 trauma center may have been they may have been beyond saving. Who the hell knows? We can ask Steve.
Mhm.
Uh,
Yeah,
Jake,
and in the meantime, Steve, I mean, if you want to share that, that details or that information about that particular incident, I could also also inquire, because you may be correct. I mean, the person could have been in such a bad state that when you mentioned, you only, time really is of essence. The decision could have been made by EMS to say, they're not a trauma center, but we need to provide some sort of care now. And the island was the closest hospital.
all right. Well, we can look into that, and we could also send you those details. We can probably do a little research.
Sure.
Jacob.
Thank you, Steve. I had 2 points here, which is the first, I wanted to continue this conversation about EMS protocols. And I used to be an EMT briefly in my lifetime, so wanted to share that I think it could be really good to speak with an FDNY commander about or captain of their EMS squad about the protocols that are in place for deciding which hospital to transport patients to. It is a very hierarchical sort of thing where it comes down to the trauma center rating of each hospital, but there's other factors that could play into that decision. So for example, if a level 1 trauma center is completely full, a patient might be diverted to a lesser trauma center. We don't really know the specifics of any one incident and why that might have happened, but I think getting to hear from that person about how those things play out could provide some clarity for the community here. And then a second point about having a trauma center in our community here. While we were talking, I did a quick looking up of New York State's health codes to look at how trauma center designations are applied. And it is actually a process that is initiated by the hospital, from what I'm understanding in the New York State health regulations here. And so perhaps, it could be worthwhile to invite someone from Allen or from any of the local hospitals to ask them why they don't pursue a level 1 trauma center designation, because it's a process that, to my understanding, based off what I'm reading in the New York codes, rules, and regulations, I can send you the link that I'm reading. It's my understanding that that's a process that's initiated by the hospital, and so it may be worth having that conversation about why not, like why they are or aren't pursuing that designation.
Yeah, that was Jacob. That was my understanding too. So
Yeah, and I think that sort of that's one of the things that Steve brought up, and is one of those things that I would take back and get some more details on that particular question.
Yeah, we'd appreciate that, because I mean, New York Presbyterian has certainly got the specialties, and should have the capability of serving as a level 1 trauma center, and I would think after the expansion and modernization of the emergency room that would even be something that might have facilitated it becoming a level 1 trauma center. But let me also mention, though, Jacob raises a very good point, which is that, and Julio also mentions that, these decisions are made on the spot, and they could very well be made because maybe the trauma center or the emergency room at Harlem Hospital was filled at the time of that accident. So they couldn't take the patient down to Harlem, and they had to look around for the closest emergency room that could serve that patient that had capacity. So, and they quickly determined it was St. Barnabas. That's probably the reason, OC, that they took that patient to St. Barnabas.
Yeah, but that's actually answer to my question, that we really need a trauma center, because not every time the hospital in an area that has a trauma center can cater to the problems that we face here.
I'm agreeing with you.
I understand it, but all I'm saying is that it's imperative to have trauma center here.
I agree. I'm not arguing with you, but I'm just trying to, when you asked earlier, why are these decisions made? We have to find out, why did they take a patient to St. Barnabas? I think the most likely answer is that the trauma center or the emergency room at Harlem Hospital might have been filled to capacity at that point, and the only room, they had to make a split decision or the quick decision to take the person to the ER that could take care of that person. I think Jacob was absolutely right on that point. Okay, any other questions? All right, I don't. We have no more. Julio, we're giving you a lot of homework, and we're looking forward to you reporting back at the next meeting.
Sure, and please send me that information on that that incident on up in Inwood that occurred.
Yeah, that was an awful incident with a speeding car that ran into another car. Then that car went onto the sidewalk and ran down two guys who were just walking along. One of them, if I remember correctly, had just given the other guy a haircut at a barber shop, and
Oh
then
my God.
they were leaving at like 4 in the morning or something. And
Wow.
it was a real tragedy. And
Well, did you have the maybe a patch article or something like that you can share?
yeah, let me see if I can. I'm sure we can.
Okay.
I'm sure
Okay.
we can find that. 'Cause
Okay.
All right.
Sounds
Very
good.
good.
So I apologize. I have to hop off the meeting because I'm I'm on my way home now. Thank you.
Okay. Take care.
All right. Bye.
All right. Well, I think that actually wraps up the meeting. Does anyone have anything else?
Yeah. Do we have an update about the textile recycling? I know you want to choke me to death for asking that again, but I will ask again.
Well, OC, if we were in person, I might want to choke you to death, but I can't do it remotely. So now I understand why you feel so secure in asking that question again. So no, I don't have an answer, but I will have to get back in touch with my contact at Grow NYC and at the Green Markets.
Okay, thank you, Steve.
Listen, I sympathize. I have a bag of old clothes in my house I got to get rid of.
I'm going to the Bronx every Sunday, 4545 Independence Avenue.
Oh, well, maybe I should join you. Although didn't you tell me that there's a Green Market at Columbia that also takes textiles?
Yes, but they're not always there.
Well, that's
The one here in the Bronx they're very reliable. They're there every Sunday.
All right. Well, thank you all. Thank you, Diane and Janelle, for sticking it out with us till the end of the meeting. And Janelle, good luck to you. I hope you. I hope you have another job in mind. So I hope we run into you at some point in the future. Tanya was absolutely correct before when she commended you for your persistence and your good and your consistency in coming before our committee month after month. I want to thank you. So we'll call this meeting to we'll adjourn this meeting at 8:43 p.m. See you all next month. Next month we're going to be reviewing a brownfield cleanup plan for a property at 401 West 207th Street. And we're going to have to come up with some quick recommendations because the deadline for submitting comments is, I think it's December the 11th, something like that. All right. Thank you all.
Thank you.
Thank you.
Take care.
Thanks, everyone. Bye.
Thank you.